There are a lot of great resources out there for nurses or any oncology healthcare professional. One that comes to mind would be the American Association of Sex Educators, Counselors, and Therapists, asect.org, where you can find certified sex therapists or sex counselors. I think remember, as a nurse, know your own limitations. And when you're asked a question that you don't have the answer to, either go find it if it's clinically appropriate, or make a referral. And that referral might be to a sex therapist. It might be to a pelvic floor therapist, which there are certified pelvic floor therapists that are physical therapists that specialize and are incredible human beings who can really help reshape and change the way the pelvic floor works through biofeedback, or helping the woman or man get better in touch with their pelvic floor to strengthen it. So knowing the resources of a gynecologist who also is informed on aging issues or willing to work with you on other ways to address vaginal health. If the woman cannot take hormones because she has a hormone positive cancer, are there other things that she can do to help address the ongoing issues related to vaginal dryness? An endocrinologist, having a good endocrinologist that you work with. So all of those colleagues, I would say, would be someone you'd have on a list that you could immediately call and build relationships with. The social worker or the oncology social worker within your department or within your clinic is a good resource when you notice that somebody is experiencing higher distress. Refer them to that social worker so that they can get the support they need to address some of the other issues that are happening. There are other resources like I mentioned before, Ann Katz, who's a great nurse, has written 2 books on man cancer sex, woman cancer sex, the American Cancer Society's resources and booklets. St. Jude actually has an incredible tip sheet on sexual health or sexuality and sex and intimacy during cancer. And although it's written for adolescents and young adults, it's a very adaptable PDF, and so you can find that fact sheet and then create your own. Create a list that maybe has resources of where somebody can find a dilator, where they might be able to buy a penis pump, where the lubricants are, what are the best moisturizers, maybe some of those books. And even just by doing that, if you put that in the new patient packet, again, the message you have sent to that patient and their partner is that, one, we care about all parts of you. We're not just asking about bowel habits or if you need help getting a ride to treatment. We also care about all the other aspects of you, including your sexual health.